the moments between an abnormal mammogram and diagnosis can seem like an eternity.
That's right, but the doctors at Intermountain Medical Center are trying to cut down that time of anxiety and get patients battling their breast cancer faster. Every year, like clockwork, Lisa went in for her annual mammogram. But in December, she got a troubling call.
I received a call from the breast cancer center wanting to schedule an ultrasound. So I came and had it that day, and Dr. Parkinson did it, and he found a mass that he was very confident would be malignant, and did a biopsy at that time, and 2 days later we confirmed that it's breast cancer.
A lump that had grown this big in just the course of a year. At that point, Lisa had decisions to make. That's where the Intermountain Medical Center's Breast Care Center came in.
All of the doctors had met together and talked about my case that day, and so they all had formed opinions.
Lisa's case was presented to the multidisciplinary breast cancer care clinic.
And we discuss most of our cases on Thursday morning from 7 to 8 o'clock. And if the patient would like, she can actually attend the clinic afterwards, where she can meet with various representatives of the conference attendees and discuss her case in depth with them.
It was here that Lisa decided her course of treatment.
The doctors recommended, and I decided to have a right total mastectomy.
Thanks to the streamlined processes at the hospital, patients are able to go from screening to detection to treatment in as soon as a week. 70% of lumps found in mammograms are benign, and advances in extraction have made the procedure minimally invasive.
We will do that biopsy with imaging guidance, meaning that we can actually do it with the help of the ultrasound probe, and we can watch in real time as the needle goes into the mass. So the patient does not have to undergo a surgical biopsy.
But even though the majority of lumps aren't cancerous, it's still important to get screened.
Breast cancer does not always manifest itself as a palpable lump. Almost half of the cancers that we diagnose are not palpable, meaning that the woman herself cannot feel the lump. We tell women to look for nipple changes, nipple discharge, lumps, fullness, unusual pain, or any symptom that is different from what they usually experience.
Family history can play a role in breast cancer risk, but 75% of patients do not have a family history, including Lisa.
There is no history of breast cancer in my family. I had the BRCA test done, and there is no history, and I don't have the gene.
Two genes, BRCA1 and BRCA2, are the only currently known genetic carriers of breast cancer.
And those women have a very, very high risk of developing breast cancer, so high in fact that many of those women will undergo prophylactic bilateral mastectomies and have their ovaries removed.
Dr. Parkinson encourages that women over 40 should get a mammogram every year.
Until reach an age at which they no longer would do anything if they were to receive a diagnosis of breast cancer. In other words, if you're healthy enough to treat it, you should continue having mammograms.
A little bit tighter.
And if you have a family member who has breast cancer,
and we recommend that those women start screening 10 years before the age of diagnosis in their affected relatives. So if your mother had been diagnosed at age 37, you should begin screening mammography at 27.
Lisa is currently undergoing chemotherapy. Then she'll do radiation and take medication for 5 years. But she is hopeful that she'll win this battle and wants to help other women fight.
Get your annual mammogram. I would yell that, shout that, hug them, cry, whatever it would take to convince my friends, my family, your friend, any woman you love, beg them to get their annual mammogram. It'll save their life.
And Lisa, thank you. Best of luck to you as you continue your battle with cancer. And thank you for being an example to women just like us.
Yeah, y'all know somebody that's going through that.
Yep. Intermountainhealthcare.org for more information. See you tomorrow.
Thanks. Have a good day, guys.